Hey guys, it's Sierra. So today I'm going to teach you about hepatitis. So what hepatitis is like an inflammation of the liver. It causes the cells in the liver to degenerate and die, and it slows the overall liver function. The prognosis is going to depend on what kind you have and like your overall health before you got it. So I'm going to go through and I'm going to explain the different kinds, and then I'm going to show you what you would see in these patients. So Hep A is transmitted through the oral fecal route. It's usually in undercooked foods or contaminated water. The incubation period for this is going to be 10 to 40 days, but you can typically recover your normal liver function in 3 to 6 months. Hep B is transmitted through blood and body fluids, and the incubation for this is 28 to 160 days. It's not really likely to go chronic. Hep C is transmitted through blood and body fluids. The incubation period for this is going to be 6 to 9 weeks. Now, Hep C is the one that's most likely to go chronic. It is, however, curable, so keep that in mind. We also have Hep D. Hep D is known as the Delta virus. It is considered a co-infection with hepatitis B, and its incubation is 2 to 10 weeks. Now, Hep D is most commonly transmitted through sex, so you're going to really want to educate these people on risky behaviors. Hepatitis E is transmitted through fecal contaminated water. So these are going to be like in underdeveloped countries in like Southeast and Central Asia, Mexico, and in the Middle East. Hepatitis G is a co-infection with Hep C. And so like your co-infections, your D and your G, you can recover from, but you're still going to have the B and C. So keep all that in mind. There's also a few other types of hepatitis I felt like I should mention. So you have autoimmune hepatitis. This is rare. And really this happens when normally the patient's going to have a pre-existing autoimmune disease. It's more prevalent in women. There are two types of the autoimmune. There's type 1, and it's going to be in women 15 to 40 years old. But there's type 2, and that's going to be in women 2 to 14 years old. We have acute toxic hepatitis. This can be cured if they find what the hepatotoxin is and they remove it promptly, because like your onset of symptoms and the time that they find the hepatotoxin, sometimes that can be too long and there's no antidote for it. So alcoholic hepatitis can occur in a patient that has decades and decades of heavy alcohol drinking. And I'm talking like 8 to 10 drinks a day minimum. And it can lead to cirrhosis. So the good news is there are vaccines available for Hep A and Hep B. Prophylaxis is really your best treatment for hepatitis. Those most at risk for hepatitis and should be vaccinated, which is really everybody, but anyways, are going to be your healthcare workers, inner city kids. And they said inner city kids because they have access to like trash cans where a lot of times dirty needles have not been disposed of how they're supposed to. People who get tattoos and piercings are also going to want to be vaccinated because sometimes people aren't sterile as they should be in those situations. Homosexual men, people with multiple sexual partners, international travelers, and IV drug users should all be vaccinated. So, next we're going to kind of get into the etiology and pathophysiology, which I've touched on a little bit. So I've said that it's the inflammation of the liver. So rarely it can be caused by E. coli, salmonella, or strep. And that's going to be a lot in like your undercooked foods. Your prognosis is going to depend on the virulence of the virus, your pre-existing conditions, and the patient's overall health and compliance to treatment. So it's really variable, ranging from completely asymptomatic to fatal, depending on the causative agent. So some of the clinical manifestations that you're going to see with these people, like what they're going to complain of, they're going to have general malaise, which, you know, is tired. They're just generally not feeling well. They're going to have photophobia, which is like a severe sensitivity to light, nausea, vomiting, diarrhea, dyspepsia, which is like a lot of acid reflux, severe headaches, lassitude, which is mental weariness, pruritus, and that's going to be because like the bile salts that build up in your skin can cause irritation. And also with Hep C, you're going to see a rash normally. It's kind of, you know, one of the giveaways. So they're going to have a lot of itching, but they're also going to have like right upper quadrant pain because that's where the liver sits. Objectively, you're going to observe an enlarged liver. You're going to see enlarged lymph nodes because that's, you know, your body's response to infection. You're going to have weight loss, dark urine. And when I say dark urine, I don't mean like a dark yellow. I mean like a tea colored urine. Like it's really dark, really cloudy, hard to see through. They're going to have pale stools because the body's not absorbing the nutrients that it needs. So it kind of pushes it all out into the stool. And it is a pale color. That's also one of your telltale signs of hepatitis. Along with jaundice, because that's the body telling you that the liver is shutting down. You're going to see jaundice of this, not only the skin, but also like your mucous membranes and your eyes, like the whites of the eyes. They're going to have abnormal lab results. And what I mean by that is they're going to do blood tests, and they're going to look for hepatitis-specific antigens. It's going to show elevated direct bilirubin, GGT, AST, ALT, LDH, ALK Phos, a prolonged PT, and an increased INR. Okay, those are your diagnostic tests. So your medical management to kind of combat this, overall, it's going to be bed rest. You're going to encourage these people to do lots and lots of bed rest. They also have antiviral medications such as pegylated, interferon alpha, ETV, and TDF. And those are going to be for your Hep B. For Hep C, you're going to have Interron A, Revitol, and Pegasus, and those are going to be your first line defenses for those. But also, they're going to look at most commonly like a liver transplant for these patients. So with that, you're going to want to offer them lots and lots of support, lots and lots of like therapeutic communication, therapeutic listening, because if they do have the alcoholic hepatitis especially, and then now they're having to have the liver transplant, they're going to have to completely stop alcohol for a year minimum in order to be eligible for the liver transplant. So that's going to be like a huge shock to their way of life. So you have to kind of take that into consideration. You're also going to push lots and lots of IV fluids. You're going to push vitamin C, and that's going to help with healing. You're going to do vitamin B, and that's going to help to absorb other vitamins and nutrients the way that the body's supposed to, and vitamin K. And so that's going to help with the prolonged PT and increased INR. So the nursing interventions that you want to implement here, you're going to monitor their dietary intake because you're going to want them to do the low-fat, high-carb diet. You're going to monitor their INOs, daily weights, because like I said, a lot of hepatitis patients experience weight loss. You're going to monitor their serum glucose levels because hypoglycemia has been linked to severe hepatitis. You're going to administer antiemetics and antacids as needed because, like I said, there's going to be a lot of nausea, vomiting, and they're going to have that acid reflux going on because things aren't processing in there the way that they're supposed to. Supplemental nutrition such as TPN, if it's needed, you're going to monitor their PT and INR. Lots of support, and you're going to promote adequate rest. So not only are you going to do like bed rest, but you're also going to encourage, like cluster care. You're gonna go in and you're gonna do as much as you can at one time without wearing the patient out. So your patient teachings for someone with hepatitis: avoid alcohol, as I've already said. Small frequent meals, because a lot of times you can't handle a big fancy meal whenever your stomach's already upset. So small frequent meals with the low fat, high carb diet. Lots and lots of hand hygiene, like scrupulous hand hygiene. Use needleless IV access devices if available. You're going to want to educate them on risky behaviors. And I've said that a few times. And so what I mean by risky behaviors is homosexual men are at an increased risk for it. People with multiple sexual partners are at an increased risk. But also you know, people who get tattoos and piercings with people who aren't hygienic, if they share their personal care items, that could put them at an increased risk for hepatitis transmission. So you want to teach them to use their own personal care items. And then, like, if you're traveling out of the country, you're going to want to use like bottled water for your oral care. You're going to want to like boil your water before you cook with it, because as I've said, a lot of hepatitis can also be transmitted through the oral fecal route or like contaminated water. So you want to teach people that travel abroad, you know, the importance of clean water while they're traveling. And that's really all that I have. I have a chart down here, and it says that 60% of people with hepatitis in the U.S. got it from IV drug use. Only 15% is from sexual contact. 10% is unknown. 1% is other. 4% is occupational. So as healthcare workers, we are at risk. And if you do get a needle stick, you need to report it and take it really serious. And follow the protocol associated with it. And then transfusions. So one way that people got hepatitis was before they really started doing the blood transfusions, and that was a big thing that they didn't know was going on. So anyway, that's pretty much all I have. Thank you.